Welcome back to the Next Appraisal Tool modules. This module addresses question 11. Are the data collection tools clearly described? Data collection tools are selected for the purposes of gathering information about study participants, events, or other elements that are included in the sample. These tools will differ depending upon the purpose of the study, research design, decisions about type of data collected, and measurement methods. One of the first considerations is whether the author chooses to collect qualitative and/or quantitative data. Qualitative data includes collecting and analyzing words. Quantitative data involves numbers. Types of tools vary widely. For example, an observation checklist might simply track whether a process or event occurs. A survey or questionnaire may contain close-ended or forced choice questions, such as multiple choice or rating scales. Other surveys or interviews may also include open-ended questions that collect data in the words of participants. For example, a researcher interviewing nurses about the use of rapid response teams to treat deteriorating patients might ask, "How would you describe your communication among team members during a rapid response?" Technological advances have increased the types of tools and modes of data collection available to researchers. More and more studies use digital devices that communicate remotely with the research team to make data collection easier for both the study participant and the research team. Participants can use applications on their phones or visit a website to enter information. While our appraisal questions focus on quantitative data, let's take a moment to discuss some differences between quantitative and qualitative data. Quantitative data includes numbers and it can be counted. We calculate frequencies, incidence, and prevalence, among others. In comparison, qualitative data is typically narrative, it's text, but it may also include images such as photos, sculpture, or sound. Sources of data for both quantitative and qualitative data include primary and secondary data collection. Primary simply means that the research team has to collect the data. The data doesn't currently exist. Secondary means there's existing data. It was collected for another purpose. When collecting quantitative data, we might use an interview or a survey that has questions with pre-specified responses. An example is, please rate the wait time between contacting your public health clinic and when you were able to schedule a visit for breast and cervical cancer screening. Would you say excellent, very good, good, or poor? In contrast, when collecting qualitative data, we use open-ended questions that elicit a response in the participant's own words. We might ask, please describe your experience when scheduling a visit at your public health clinic for breast and cervical cancer screening. This table shows some common sources of data for each type. In public and population health, it's common to collect data from these existing data sets at the federal, state, and local level. In qualitative data collection, individual interviews with key informants or conducting focus groups with community members are great ways to collect detailed information. A comprehensive comparison of quantitative and qualitative data, along with the pros and cons of each, is beyond the scope of this module. But by the end of this module, we want to help you understand that when evaluating a research article, the data collection tool needs to be clearly described. Another module will discuss the relevance of study tools and the relationship to study purpose. Here are two examples that describe the data collection tools with enough detail so the reader understands the data collected. On the left, the retrospective quasi-experimental study investigated the association of state-level Medicaid expansion and non-elderly mortality rates from 1999 to 2018 in northeastern urban settings. Datasets and years of the data are clearly listed. Although not shown for the sake of brevity, the text goes on to describe categories of mortality and the definition of all-cause mortality. On the right, the retrospective cohort study compared the risk of mortality among people with opioid use disorder on and off opioid agonist treatment in a setting with a high prevalence of illicitly manufactured fentanyl and other potent synthetic opioids. The authors linked individuals across 5 health administrative data sets to measure drug dispensations, hospital admissions, physician billing records, ambulatory care reports, and deaths in British Columbia. For each data set, the authors clearly stated the information extracted. Let's read this excerpt to answer our appraisal question. You may wish to pause the recording and then restart the recording when ready. When stating the study design, authors introduced the data collection tools. The objective of this mixed method study was to comprehensively understand the barriers and facilitators that lactation professionals and supporters experience when providing lactation services and support to families in Appalachia. A sequential design has at least 2 steps. In this study, investigators first conducted quantitative cross-sectional survey and used the results to create an interview guide for qualitative semi-structured interviews. Data collection tools are also available in the supplemental material for the reader to review. Authors also indicate the survey was online and that the interview was via phone. It's common to initially conduct qualitative interviews with an interview guide having open-ended questions, and then you use the qualitative results to create a quantitative survey so that it can be distributed to a much larger population, because qualitative interviews can be very time-intensive. In conclusion, the rationale for a yes is that the author clearly describes both data collection tools, a semi-structured interview guide that was subsequently used to develop a survey. The authors list the topics that the questions addressed, and as a bonus, there is supplemental material that includes the survey and the interview guide. Congratulations! You successfully completed this module. You may return to the main menu or continue to other appraisal modules and the next EBP course.